Welcome to the Infidelity Doctor channel. My name is Dr. Talal Salim, and this is the Ask Dr. Talal segment, your place to ask me anything you want to know about affair recovery and affair prevention. Please remember, this is not a substitute for the counseling that you're supposed to be getting. This is merely a place for you to get some basic questions answered and a place for you to learn about my clinical insights when it comes to affair recovery and affair prevention. So before we get to the question of the week, make sure that you like the video and subscribe to the channel so that you can get the most recent updates. So the question of the week is as follows. How much of the affair narrative details I should expose myself to? To be honest, clinicians are actually split on this topic, depending on their theoretical orientation and the modalities of treatment that they use to treat infidelity. There are some folks who believe that the betrayed should know every little detail, big or small, and there are some folks who say that, who cares about the affair details? Why can't we just focus on rebuilding from this point forward? For me, I really believe the amount of detail that a person should be exposing themselves to should be different from person to person and from one relationship to another. There is no one size fit all, because the narrative of the infidelity is actually what make or break the recovery process. Because in order for someone to figure out should they rebuild or should they not rebuild, or heal individually or heal together, they have to understand what type of infidelity took place and why it happened. Because if you get too little of details about the affair causes as well as the type of infidelity that took place, you might not really be making an informed decision on whether or not you want to rebuild with this individual, but also you might not uncover an important aspect of why the infidelity happened, which means that you could be increasing the risk for relapse. If you expose yourself to more information than you should, then you are risking prolonging the PTSD symptoms that you're going to be experiencing and on the journey of recovery. You're going to be dealing with a lot of unnecessary images and thoughts in your head, more than you need. So my policy on that one, the appropriate level of disclosure is really just going to be based on the unique circumstances of each couple and the type of infidelity that they dealt with. So in my clinical process, I give the unfaithful the opportunity to tell me the story. As the clinician, I ask some guiding questions to help me determine sequence of events, as well as some information that will help me to begin categorize the causes of infidelity as well as the origin of that infidelity. But I always tell the betrayed that you have every opportunity to ask any question that you want to know about the infidelity. But my policy on that one, you have to allow me as a clinician to weigh in on whether or not this is a good question or a bad question. So it's a good question to ask if the answer for this question is going to help you understand what type of infidelity happened and why it happened. If you're able to make a case for it, then it's a good question to ask. But even then, the answer to that question should be done at the lowest level of detail possible. To put this into examples, so let's say you have somebody who is dealing with sexual affair, and the betrayed want to know what type of sexual position that the unfaithful and the betrayed were engaged in. Is this really an important detail to have? Well, the answer is just really going to be it depends. For example, if the sex affair was caused by an individual factor that has nothing to do with the relationship or the betrayed partner, such as the case of sex addiction, then it doesn't really matter what type of sex position that the betrayed, that the unfaithful and the third party were involved in, because it's really not a compatibility issue or differences in somebody being vanilla, the person identifying as somebody in the kink community. It's really more about the addiction piece. Now, if the sexual affair was caused because of a relationship deficit related to compatibility, like I said, you have somebody who has vanilla and the other person identify as someone who's in the kink community, then it's a valid question because I'm the betrayed. I want to know how incompatible we are, right? But even then, the answer should be done at the lowest level of detail. We don't need technicolors because you don't need any additional images to worry about as the betrayed. So hopefully that answered the question of the week. Feel free to leave your comments about the answer that you heard today on the comment section below, as well as suggestions of questions you'd like to see me answer in future videos. Until then, be well, be safe, and embrace the possibility for a brighter future. Take care.